The most common allergic symptom I see is that the histamine actually causes, believe it or not, think about it, science, write this down, everybody.
The second most common question that we had was about digestion.
Yeah.
People asking, Jessica was asking, could this be related to my stomach pain, changes in my
Yeah.
bowel movements,
Yeah.
diarrhea, constipation, nausea, like all of those.
This brings up a really good point because when we're talking about it, under the mast cell, the histamines here, it says allergy symptoms, right?
Mhm.
I don't want to dismiss the allergy symptoms, but I think the allergist is really limited in their scope, what they think are allergy symptoms. Because I can tell you right now is that when we're looking at allergy symptom, it's not just the itchy hives, the rash, the throat swelling, right? The most common allergic symptom I see for people with mast cell activation syndrome is that the histamine actually causes, believe it or not, think about it, science, write this down, everybody. Histamines in the gut blood vessels causes local swelling, okay? Local swelling, the blood vessels dilate. So then there's swelling. So it gets super swollen around the intestinal walls. That causes decreased digestion, decreased absorption, right? And because of all that swelling, there's a lot of liquid that water that's being drawn into the bowels. Instead of absorbing it, it's actually adding to it. And then all these inflammation cells are starting a war zone in your whole gut with this. So one of the major symptoms of histamines in your gut is gas, bloating, diarrhea, pain, cramping, or the food just sitting there. Your bowels refusing to move.
Mm.
Boom. Hi, I'm Maggie Yu and Dr, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training.
And yet, when you're going to the doctor to get help for some of these issues, no one is bringing up, oh, maybe it's a histamine problem.
Well, the thing is, the allergist is not your GI doc. And your GI doc ain't an allergist. So then they're punting all over the place. And so instead, you go to the allergist and they're just like, let's just prescribe some allergy medication. This is an issue, by the way, everybody. Speaking about the treatment for mast cell activation syndrome, I know we're going off topic a little bit, but those of you that have mast cell histamine or have seen the allergist, these are the drugs you get given, right? The Allegra, the Claritin, the Singulair. Maybe you're lucky, some of the other drugs, the nasal chrome, the sodium chromolam sodium, or ketotifen. But one of the most common drugs they prescribe is actually Zantac, famotidine.
Mhm.
And one of the reasons is because this is interesting, science, everybody, is that there are different kinds of what we call histamine receptors. Like we call them H1, H2, different receptors. So while, and proton pump inhibitor, right? So what happens is famotidine, Zantac one of the main reasons we take it is to shut off stomach acid, but it also shuts off the histamine receptor in the gut. So they're like, let's just give this antihistamine, which is Zantac. But the problem is they're shutting off your stomach acid, which then what creates more histamines. So it doesn't work. It doesn't work. And we're just talking to Nellie on Monday. Remember, Jason? We have somebody, we have people working with who have seen these docs for mast cell, and they're on like 3 to 6 different medications. And they're like, I don't even know how to make tails or ends. And the thing is, she's taking like 3, 4 medications and it's not working. If it was working, we're talking a different story. And as we're going through even the medication list, thinking about this, the last medication that somebody with mast cell should be on, or histamine problems, should be on like a Zantac. Even though it has an antihistamine receptor blocking ability, it also blocks your stomach acid, and that's no good. That is not good. You don't want to kill your stomach acid.
Yeah, and I was going to say too in the chat, Karen H mentioned that she was lucky to have an allergist that was respectful and recognized the mast cell activation syndrome, but they don't know what to do with it except for Zantac, right? So, yeah.
Look at her cardiac symptoms. Karen, thank you for bringing this up. I want to really jump in on cardiac, okay, everybody? Histamine pathway triggers cardiovascular. Please know this is scientific. Please write this down, okay? And please no longer let yourself be medical gaslighted, because here are the symptoms of cardiovascular effect of histamines. Your heart rate can increase, okay? People can even have arrhythmias like AFib or PVCs. People can have blood pressure change up or down. People can develop symptoms related with POTS, postural orthostatic tachycardia syndrome, or dysautonomia. People may just have vertigo, okay, meaning dizziness. All of these can be absolutely linked to a allergic reaction environmentally or to food relating with mast cell or histamine intolerance. Boom. Write down in chat right now that's you, so we can validate this for everybody else, because let's not ever be medically gaslighted again. And that being said, I'm going to say something here. POTS and dysautonomia, these kinds of symptoms, don't belong in the cardiologist's office because it is not a cardiology heart-based problem. It's a mast cell activation, histamine intolerance, digestive issue, and even autoimmune related issue.
And a while back, actually, Heather had mentioned, hey, this is before you mentioned POTS. She said, POTS symptoms, I believed, are combined with this. So smart, Heather, because she was connecting the dots for herself. And yet I'm sure she's not getting help in the medical field.
Well, and that's a good question, Heather. Like you're smarter than your doctors because she's combining POTS with mast cell. And we talk to people on the phone every day who are making these connections, right? And when they call us and talk to us, they're talking to people who, yes, I know exactly what you're talking about. Yes, it's real. But I'm wondering what kind of reception she's had trying to work with her medical providers on this, because I will tell you right now, 100%, well, 99.9% of medical doctors would be dismissing this connection that she's making. And it's really real and it's really scientific, Heather. You are currently smarter than 99.99% of doctors on the planet.
Mm-hmm. And she says she wasn't even diagnosed with mast cell officially, but she does have a good doctor, she says, that knows she has these symptoms, but no treatment yet to help.
Okay, so Heather, we're going to move into solutions. Okay, we will, as we're talking about this, when you're thinking and realizing what the cause is, who wants solution to mast cell, right?
Yes, yes, and yes.
And because we just talked about digestion as being the big problem, when we are talking about the food mapping masterclass that we have, a huge piece of this is this left upper corner digestion. You freaking please, people, master the digestion. There's nobody else teaching this. In our food mapping masterclass, we teach you how to understand, master the digestion pieces. We also test you for those food sensitivities, so you're not on elimination diets that make you worse. And and people on mast cell histamine are on crazy ass elimination diets that are making them sicker. And then we really want you to understand the role of histamines in these food reactions, right? And then also why people get so nutrient depleted as a result of this. So this is my food mapping masterclass, but critically right here, number one, digestion, bing, 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 bing. And I will tell you right now, we fielded hundreds of calls over the last month. And I would say the number one thing that's making people knock on the door and they're screaming and saying, you're the first person I heard that really links my GI symptoms, my gut symptoms with my food reactions or food allergies. Or you're the first one to link mast cell with POTS. Or you're the first one to link autoimmune issue with mast cell or POTS, right? So this is really hitting a nerve. And I want you to know that you absolutely can fix this, but I don't see a masterclass in digestion or food allergies out there anywhere. It doesn't exist. I put this together into one program specifically because it answers every single piece that's missing in mast cell and dealing with POTS and histamine. Dr. J?
As far as putting the connection with digestion, again, there's just no one else doing that. I just want to just out myself a little bit. I have, 24 years, 25 years of doing this, not quite as many as Dr. Maggie.
She ages of me.
Yeah. But that all said, I never got the connection with digestion and mast cell until, we started working together. And it's just mind-blowing.
To learn more about mast cell activation syndrome, histamine intolerance, or any allergic related reaction, comment in the comment section below, mast cell help.